Dear students, the second lecture about pulpitis of temporary teeth in children and patterns on clinical course in children at all ages. The clinic diagnosis differential diagnostic. Let's start. If you have some questions, you can uh, write in Google Class or under this video. So, classification of pulpitis by etiological sign. You should know that infection is the most common cause of pulpitis. Microorganisms penetrate into the pulp and chamber from the carious cavity. Mechanical trauma is the second leading cause of pulpitis. It occurs in case of concussion, then fractures and during carious cavity preparation. It has been proved that the largest damages of pulp occurs at speed of bore in the range of 3,000 to 30,000 rotations per minute without a bore cooling. Then pulpitis in deciduous teeth and classification. You should know that we have acute pulpitis, then acute serous diffuse pulpitis, acute purulent pulpitis, acute traumatic pulpitis. Then second group, it is chronic pulpitis. Chronic fibrose, chronic hypertrophic, chronic gangrenous pulpitis. And the third group, it is aggravated chronic pulpitis, and the fourth, pulpitis complicated with periodontitis. Classification of pulpitis by etiological factors can be infectious, traumatic, and iatrogenic. And physical reasons, it is preparation, dry and cold, heat, it is taking an impression, making filling materials. Chemical causes, etching, adhesive systems, filling materials, cleaning and drying agent, and different antiseptics, varnishes, and materials for filling. Then classification hyperemia of pulp. It is classification by Yavarskaya and Ubernovich. Hyperemia of pulp, acute limited pulpitis, acute diffuse pulpitis, acute purulent, traumatic pulpitis, and accidentally affected area of the pulp during carious treatment, and opening of the pulp during a fracture of the tooth crown. Then chronic pulpitis, chronic fibrose, hypertrophic gangrenous, and calculose pulpitis. And morphological prerequisites for the features of course of pulpitis in children. First of all, it is thin layer of dentin and enamel, low degree of mineralization, lack of differential of coronal and root pulp, unformality, looseness, fabrics, unripe pulp. Then, on the development of the nervous apparatus in the immature pulp. White apical foramen, a development of pulpitis with a shallow carious cavity. Fast spread process in the pulp. Then, mostly chronic pulpitis flow, lack of expression, painful reaction, absence of pain irradiation. Then the presence of a periodontal reaction, fast spread process of periodontal, the possibility of violation general fortunes. Then criteria of differential diagnosis, complicated and uncomplicated caries at children. So first of all, it is anamnesis. Then it is dental examination of mucous membranes, characteristic bottom carious cavities, comparative, then diagnostic preparation, and X-ray examination, of course. Endodontics of teeth in children. This topic is very hard, and you should concentrated in some necessarily seen. For example, anatomical structure of temporary incisors and canines. You should know about tooth length, about quantity of dental canals, about frequency of apical foramen. Yes. So please write in your synopsis this table. Then temporary molars also. Of course, when you will work in endodontic practice, you should use apex locator and X-ray. So these millimeters, it is very medium points, okay? So frequency of occurrence of additional canals and temporary teeth. Here are persons. Also, please write. Morphology of deciduous teeth and odontics. Morphological features and features of endodontics. So, pulpitis in deciduous teeth are extremely difficult to diagnose. As a rule, children cannot clearly describe their subjective sensations and objectively estimate their reaction to the doctor's diagnostic methods, for example, percussion, probing, thermometry. The patient's reaction depends on his psycho-emotional features. Then development of inflammation in the pulp and clinical picture of pulpitis in deciduous teeth have a number of features. First of all, it is inflammation of the pulp, often develops in case of the shallow carious cavity. It is explained by the number. It is explained by the number of factors. Dentin layers is very thin and poorly mineralized in deciduous teeth, especially to the stage of unfished root formation. Then, topographic, anatomical, and histological characteristics of pulp in deciduous teeth contribute to rapid spread of inflammation to the entire coronal and root pulp. Then, chronic forms of pulpitis prevail in children and they develop as a result of acute pulpitis or as a primary chronic process tending to aggravation. Then, a clinical picture of the same form of pulpitis may manifest with various symptomatic complexes depending on the stage of root development. Serous form of pulpitis rapidly transform into the purulent ones. Remember, please. Acute form of pulpitis develop with the symptom of perifocal periodontitis. That is explained by topographic, anatomical, and histological characteristics. Zinc oxide F-genol pastes we use for obturation root canals. Then permanent root canal obturation of a temporary tooth. Picture. Then a iodoform paste and some examples. KRE paste, it is iodoform, camphor, parachlorophenol, and menthol. Paste Meister, iodoform, camphor, parachlorophenol, and menthol, zinc oxide, thymol, lanolin. Tempo 4, iodoform, camphor, menthol, thymol, creosote, zinc oxide of genol, and stearate, barium sulfate. anti-odent plus iodoform, chlorophenol, and camphor. Extemporal iodoform containing pastes, so that we can do in dental clinic. And pulpitis treatment methods. So it is amputation with anesthesia using pharmacrazole and other medications, and after devitalization. Amputation, this method when you work only with crown pulp, and extirpation when you work with crown and root pulp. Pulpotomy of deciduous teeth, so amputation under pain relief and amputation after devitalization, and means for processing and covering the pulp stump. So we use for amputation under pain relief pharmacrazole, 3-5 minutes on the stump, zinc oxide digenol. Then for after devitalization, it is paraform pastes on the stump. Then fixation superficial layers pulp, transformation pulp in mummified aseptic heavy, and control, it is clinical in immediate days, radiological in 3-6 months. Pharmacrazole composition, look please guys. Formalin, crizole, sorry. And vital amputation, composition powder and liquid for vital amputation. So, for example, acute serous diffuse pulpitis. It is a stage of formed root is characterized by complaints on spontaneous paroxysmal pain that occurs mainly at night. The child can't sleep and often wakes up from pain. Objectively, dental examination defines a carious cavity of various depths filled with light soft dentin. Tooth percussion may be painful. An attempt to remove the softened dentin and probing of the bottom of the carious cavity provoke sharp pain. Cold thermal irritants also cause strong pain. At the stage of root formation, the clinical picture is not clearly expressed due to good outflow of inflammatory exudate, which does not accumulate in enclosed space. These conditions lead to necrosis of the pulp or to chronic inflammation of the pulp. Next one, vital amputation. First visit, of course, we should do in anesthesia. So vital amputation. Then we should opening the cavity with sterile bore, of course. Then pulp amputation we should do in. After this, this method of treatment presupposing removal of the coronal part of the pulp under anesthesia and preservation of vitality and functionality of the root pulp. So, indicators for vital pulp amputation in permanent teeth with immature roots. It is acute traumatic pulpitis. If more than 6 hours passed since the injury and pulp significantly exposed, then if treatment with biological method is ineffective or contraindicated. Then acute serous localized pulpitis, acute serous diffuse pulpitis without the expressed reaction of periodontium. And treatment technique, local anesthesia, yes. Then we in children, especially younger than 10 years, infiltration anesthesia is more frequently used than the nerve block anesthesia. The dose of the anesthetics for children is always less than that for adults. For treatment of maxillary teeth infiltration, applied more distally from the projection of root apex, it's enough in most cases. For treatment in the lower molars in children about 10 years, it's recommended to use mandibular anesthesia. Step 2, preparation. Then step 3, opening of the pulp chamber with sterile fissure or spherical burrs. The caries cavity should be regularly irrigated with a warm solution of non-irritation antibacterial preparation. The coronal pulp is removed with the sharp excavator. Step 4, it is hemostasis of the bleeding from the pulp with special preparates, for example, Vasoceptine, Viscostat, company Ultradent. Then some authors recommended to use warm, sterile physiological solution or distilled water for controlled hemostasis during the vital amputation. After that, the cavity is dried with sterile cotton balls. If the bleeding does not stop in 4 or 5 minutes, it proves the inflammation of the root pulp and necessarily of its complete removal, extirpation of pulp. Step 5, the surface of the root pulp is covered with a soft paste containing calcium hydroxide, for example, calcipulp, calcept. Then, after application of calcium hydroxide, on the wound surface, a layer of superficial colliquative necrosis is produced. Then we use mineral trioxide aggregate based on calcium oxide, and other calcium compounds may be used also for the capping of pulp stump. Step 6, it is a permanent filling of the caries cavity with the use of isolation liners. Then strict septic and antiseptic conditions during the dental manipulation and protecting from irritation of the root pulp guarantee the treatment objectiveness for the method of vital amputation. After treatment of pulpitis in permanent tooth of by the method of vital amputation, the child should be regularly observed by a dentist. And the first control visit is scheduled in 10-14 days, the next in 3, 6, and 12 months. Then pulpotomy. Of course, you can see amputation under anesthesia and after devitalization. And different preparations, medications. So you should write in your synopsis, okay? Then what tactic we should choose for treatment pulpitis in deciduous teeth? Of course, it's very necessarily table because you will have many tests tasks in the exams or in croc, and it's very important table. You should know the diagnosis and then type of treatment. For example, acute diffuse cirrhosis, you can use vital, devital extirpation. Then, for example, chronic hypertrophic pulpitis, you can use vital amputation or vital extirpation. Morphology, permanent teeth in children and endodontics. Here, morphological features and features of endodontics. So wide opening of the tooth cavity, lack of stage of expansion of the mouth, standard technique and large instrument sizes. Necessity of its careful removal with headstrong files. Then inappropriate apical support. Gentle rinsing throughout cleaning of all walls. Careful instrumentation and control of canal closure. Exact determination of working lengths and gentle instrumentation, non-irritating medication. And morphological features. X-ray picture of root with the unformed root that needs endodontic treatment. Please look. Here it is unformed root. We don't have apical foramen. And some clinical pages and X-ray for understanding of the Crohn's area and for pulpitis. For example, guys, you can see here non-formed roots. And here you can see white apical foramen. It is not formed apical foramen. And you can see endodontic treatment in the first molar on lower jaw. And here patient need retreatment. Okay, and you can see here instrument, part of instrument, and inflammation on under the root. Then here you can see filling. It is second molar, deciduous molar, and look to the contact surfaces, and we have pulpitis here and unformed foramen, apical foramen. Then disclosure cavities tooth from unclosed apical hole. Instrumental processing of the tooth canal with the iron unformed root. We should work not near the Crohn's area because we can have trauma of Crohn's area. Please look here. Look where is instrument. Then epixogenesis and epixification. It's very important method in pediatric dentistry. Then we need to do information of the root. Look, please. And then we will see dynamic of such treatment. So epixogenesis. Then vital amputation. It is a pulpotomy according to Queck. You should do in a local anesthesia, then isolation with rubber dam, pulp amputation with sterile burr, then stopping bleeding, non-hardening calcium hydroxide, solidifying calcium hydroxide, then filling It is glass ionomer cement or composite, is very necessarily, and dispensary observation, and permanent root canal obturation. It is pulpotomy and clinical pictures, steps. Stop bleeding, yes, and restoration. After 1 year, look please to the crown part. Look please to the periapical tissues. It's very good result. Also pulpotomy, sorry. Then technique for vital amputation in permanent teeth with an unformed roots. Look please. Also we work only with the crown pulp. It is calcium. Then mechanism of action of calcium hydroxide. It is acquisition of bone resorption and stimulation of bone formation, of course. Mechanisms of action, first of all, it is antibacterial and lyse effect, anti-inflammatory effect, and full inactivation microorganisms in 1272 hours. 97 sterile canals versus 66% after the use of phenol. But at pH from 9 to 11.5, anaerobic microorganisms survive. Then slow action, complete antibacterial effect, usually in a day. The need for direct contact, then poor dentin penetration. When removed from the apex, inflammation with inhibition is possible, healing in like 2 weeks, and negative effect on the healing of marginal soft tissues. Calcium ions are involved in the reaction of bone formation and in the blood coagulation reactions. Aqueous suspension of calcium hydroxide. Look please how it looks. It is medication Calicept and Calicept Raw. And pH of this material. Calcicure, company Waka. Calcsil, raw and suspension, also pH and medication. Metapaste and Temp Canal, company Meta by Meat and Pulp Dental. And here pH of medications and different examples of calcium. Calcium hydroxide pastes, for example, it is calcigene, calcite paste, hypocal, multical, cyprocal, ultracal, XS, and apex tent. Guys, please remember these examples, because when I asked you on previous academic year, you don't know these examples, unfortunately. You should know it. Calcium hydroxide containing good departure points. Look please. Then, important to remember when working with calcium hydroxide paste. Guys, remember that storage period and conditions. Do not put paste on a blood clot. Timely replacement of paste with a fresh portion, and long-term temporary filling hermeticity. Then, outcome of vital amputation in permanent teeth within unformed roots. Please look. It is a special bone bridge after calcium. And here we have vital pulp. Indication to endodontic treatment of permanent teeth, a treated method, vital amputation. Amputation method treatment by about chronic fibrous pulpitis, then obliteration root canals, necessity fixation intracanal structures, and inefficiency amputation treatment. Epixogenesis after it is 8 years and 10 years, and please look to the X-ray. Tooth number 11. Sorry, 12. Yes, 12. Then epixification technique. Of course, you need doing a local anesthesia. Then isolation of rubber dam. It is a very necessarily step. Then mechanical cleaning of the canal, not reaching 1 millimeters to the top. Then medication canal treatment, non-hardening calcium hydroxide, solidifying calcium hydroxide, then filling with glass ionomers or composite, dispensary observation, and permanent root canal obturation. Formation of the apical portion of the endodontical treated tooth with an unformed root. Look, please, how we walk. We leave 2-3 millimeters. And after our root canal obturation, if we're doing right this obturation, we will have such picture. It's very good result. Temporary obturation of the root canal with an unformed root with calcium hydroxide. So we leave 2-3 millimeters. Remember this? Sorry. So here we leave calcium, then we leave isolation layer and filling. Temporary obturation, also 2-3 millimeters. Epixification technique. So we have such a picture. And then we have such progress. Also apexification. Please look on X-ray. Techniques 8 years and 10 years. Look please to the root. And mistakes. So here doctor work with permanent material with gutta and he don't leave 2 millimeters, and it is mistake. Method of obturation of root canals: obturation with one point, single point obturation, obturation with gutta percha. It is called pins. It is chemically plasticide called gutta percha, warmed gutta percha, and thermoplastified gutta percha. Then inverted pin. Please look on the page. So here we have very big amount of pins. Lateral compaction. Obturation root canal modified method, vertical condensation with gutta percha is very quick method. Look please. But lateral compaction, vertical condensation you can use only in permanent teeth when we have formed teeth. Okay? Then obturation with modified method. Look please on the picture. Biological method of treatment of pulpitis, it is elimination the cause, sedative lining, of course calcium hydroxide, zinc oxide evgenol paste, antibacterial and anti-inflammation paste, and delayed recovery. Action of calcium hydroxide on pulp coating, it is stimulation of formation of the reparative dentin, antibacterial action, neutralization of high acidity of the environment, decrease in dentin permeability for microorganisms and their metabolic products. And calcium hydroxide base. Then act zinc oxide evgenol paste. Action of evgenol, pain reliever, antibacterial action, irritant by direct contact, then from close, allergization, inhibition polymerization, metacrylates, then properties, moisture absorption. And paste properties, good sealing, education, reparative dentin, and low strength and high solubility. Antibacterial and anti-inflammatory pastes, tislegermix, facalmine, valpomyxin, septamyxin, and valpociptine. Contraindication to a conservative method determined. It is cavity location, general condition of the body, of course the degree of diagnostic accuracy, and doctor's capabilities. The choice of tactic of the treatment of acute pulpitis permanentis, also lupus period of root formation, and diagnosis. For example, acute diffuse cirrhosis, vital amputation, or vital davital extirpation. Okay. Then chronic pulpitis and permanentis. Also, please write these tables in your synapses. I wait for your synapses. Have a good day and write your questions, please. If you have this question, you can write it in Google Class. Goodbye.